everyone. I'm so excited to be here again this year. Good evening from Nigeria and from any part of the world where you are. We welcome you to our panel on community and planetary health or climate change in the 2023 Engage Africa Foundation Festival. It's so nice to come together again to talk about health in Africa. And today we have our panelist, who is Okuna Juliet. She's a public health advocate. Okuna Juliet is a community health advocate with 5 years experience in community health practice. She hails from Delta State, Nigeria. She works with Simadi at the Primary Healthcare Center and also runs a teens club at the secondary school level. She leads her team for the delivery of healthcare service, free healthcare service in Ijala community, Warri Delta State. And she also champions a weekly care program for women. Her work is focused on the promotion of access to quality healthcare for women and children for the reduction of climate change vulnerabilities. Okuna Juliet, you're welcome to this panel and we're excited to have you here. You're welcome.
Thank you. I'm excited to be here as well. Thank you.
Yeah. So at this point, we are going to jump into our discussion because I'm promising you there's going to be an exciting session. So anywhere you are from around the world, please like pages online, Facebook, Twitter pages as we get it rolling. Then I am your host, Adaobi Ugwu, and I'm going to also be doing this session with my co-host, Kehinde Akinsola. You're welcome.
Yeah, thank you. Thank you, Adaobi. Thanks so much. Good day, everyone. Wherever you are, good afternoon, good morning, and good evening. Hope you are doing well. Okay, so I think we just roll up into the question, and let's see, we have with us Okuna Juliet, and I would like to just roll with the first question, if you don't mind. So let's just start with the first question. How does climate change impact the health of women and children at the primary healthcare unit level, and what are some specific challenges you observe at your work? You being somebody that work at the primary healthcare center and also have like what you do weekly. So we just want to know, how does you think this climate change impact the health of women in the primary healthcare center?
Thank you very much for that question. I would say climate change is one topic that people do not really want to connect with. I would say we don't believe. Okay, I would include myself in this conversation. I would say we don't believe it's a problem, actually. For instance, when there is an increase in temperature and it results to heat, exhaustion, stroke, hypothermia, etc., people would always feel it's a demon. Hypothermia, for instance, when a child's temperature is over, it has gone above 37 degrees Celsius, there is a possibility that that child might have convulsion. And coming to the community level, you start seeing women bringing all sorts of herbal medicine to cure convulsion. So we'll carry all these juju stuff and they'll start praying and believing it's a demon. They don't believe that there is something called climate change. Just as we have the increase in temperature, we also have excess rainfall, flooding, drought, etc. This excess rainfall makes children to come down with so many illnesses like flu, cough, catarrh, cold, sneezing. Just recently, I was battling my daughter from the flu, cough, and catarrh, and it was not really easy combating with the flu, all as a result of the climate change. I also pick flooding as one of our major challenge here. This flooding has rendered a lot of women and children homeless. As the rain falls this period, this season, rivers are over flooded. The banks, when the rivers overflows, it overflows through the banks and into our communities, thereby contaminating drinking water, which can cause diarrhea. Let's not talk about the outbreak of malaria as a result of this, because that's another topic of its own. Then when we talk about the challenges, what are our challenges? I made mention of one earlier. People think it's witches and wizards. That's their problem. That's one of the major challenges we have. Letting these people know that this is not witch, this is not wizard. So there's no need drinking agbo. You see, a lady that has a flu, for instance, will tell you it's an agbo. We had one recently of the COVID-19. You see, people were drinking ogogoro and the rest of such, that it is demon, it is this, it is that. So we see that's one of our major challenges, getting to change the mentality of these people that it is not demon. This is the climate change we are facing. And also, government doesn't make this outreach, or rather this advocacy, to get to the community level enough. For instance, when the outbreak of malaria started, or rather it's still there, but there is a season where we have our malaria is top of the list. There is a season where diarrhea is top of the list. There's a season where typhoid is top of the list. By the time all of these diseases start coming through, we don't have enough drugs for treatment to treat all these illnesses. So I think the government also is part of our challenge. They should try as much as possible to make drugs available, not just for all of this, for the mothers, the children, and of course, the general public.
All right. Thanks so much. I think this is really a good start, and I really enjoyed the conversation. But before I go to the next question, I just want to do a follow up on what you said. I know you mentioned beliefs. People have different beliefs about this climate change, all those things that Agbo and the rest. I know people's belief is not limited to your location. I think is everywhere. I think the way we can come in to see how we can let people know about these things is part of us. Climate change is real. So I just want to come in from the angle of the flood. You said the excess of rain, which sometimes can lead to flood. I want to know, you that are in your PAC, have that rain one way or the other affected your PAC before that now make maybe the center not accessible for women or the community people to use the facility?
To the best of my knowledge, yes, once. But one thing about this part of the worry, the area, is that the flood doesn't stay for long. It flows. Give it about an hour or two, the water would just flow on its own, and that's it. For other parts of worry, it's not like that.
Okay. All right. Okay, so let me just go to the second question before I bring in Adaobi. So the question will be, in the context of community and planetary health, what role do primary healthcare units play in addressing the health needs of women and children in the face of climate-related health risk?
The healthcare units are frontline functionaries to deliver comprehensive primary health care and to respond to various health challenges and outcomes. So this healthcare unit is an instrumental tool in creating awareness to the mothers, addressing them about the health needs to every slight change in the climate. For instance, I would use last week as an example, where we had our routine immunization.
Okay.
The weather was very cool. And the child was very short. And a nurse drew attention to it and said, this weather is not for this type of clothing. When it's hot, this is what is suitable when the weather is hot. And when it's cold, cover your children properly. And after hearing the nurse gave that uh, advice to the mother, that became my topic for last week's Thursday's immunization. Your children, how is on this extreme. When it's cold, it's extremely cold. To avoid the risk involved in cold weather and in hot weather, try as much as possible to address your children and yourself according to the weather, according to the temperature. So it became our topic for last week. So we're able to educate these women that dressing your children rightly for the right weather is the best.
Oh, that's nice. Thank you so much, Okuna. Just like your response is taking us to the next question, dressing the children appropriately in line with the weather condition. Because my question is actually for you to share an intervention or strategy that is being adopted at that level, at the primary health care level, to help improve the health outcomes of women and children. And like you just mentioned, one is the true health education of these women at the healthcare center. So I will leave the floor to you to share other successful interventions. Like you said, that more is yet to be done by the government. But at this level, maybe at the community level, what else? What other successful strategies have worked? Because there could be other health workers listening to us that would want to pick one or two things from what you're saying that they could also implement at the level. Thank you.
All right. Like I said earlier on, health education is a major tool we use to educate our mothers, letting them know what to do at every slight change in our weather condition. Also, I'll bring the government into this well. When outbreak of vitamin A, vitamin A to be distributed to kids between I think 6 months to 59 months, to be distributed between this age range, this age bracket, 6 months to 59 months. That's about 6 months to 2 years, or 1 year and 9 months, 1 year and 10 to 9 months, 9 to 10 months rather. So when there is an outbreak like this, you see healthcare workers into the community doing door-to-door administration of these vaccines that are being given by the government. For instance, we have the polio vaccination, which is a common one, a common vaccination that everybody knows about. You see them carrying their kick polio pack, or the outbreak of yellow fever distributed to the masses on community level. Then also, the primary health provider, have this one-on-one interaction with the community, because we are at the community level. So we cancel every day when there is an issue. For instance, a mother comes to the being given, we listen to them and can tension in providing healing touch to their health, and also providing touch to the planet. It is said that when you educate a woman, you educate the nation. So by the time we educate these women, they go home and educate their husbands educate their older children, and also educate the community at large.
Oh, that's a nice one. When you educate a woman, you've educated every single person around her. Because while she does her normal talking and gossip and everything, the information will be passed across. That's a nice one.
Yeah.
Okay. Now, you've talked about health education, door to door sensitization, especially in the event of disease, outbreak, and epidemics. Then one on one counseling. Okay. It's just like your part of your response has also entered to what I wanted to ask you. But we just want to know if there is any specific strategy you use for, like a strategy for inclusion of these marginalized women and children. Like you've mentioned, you bring them closer, you talk to them, they talk to their family members and their community members. Do you have extra strategies that you employ, that's just to make sure that, the idea is to carry everyone along, everybody is included, nobody is left behind in this goal of the SDGs? So do you have more strategies that you employ in ensuring that?
Yes, there are more strategies we employ. I'm always using the word we because I'm not the only one in the facility. So it's
Of
it's
course.
not just it's not just me, of course.
Sure.
So after educating, we do something called the monitoring evaluation. You don't just educate and let them go. So we do this regular monitoring and evaluating the initiative to assess their impact in their community.
Okay.
So when
Wow,
there is,
that's it. That's good.
okay, all right.
No, continue. I said that's nice.
Okay. And also we let them know that their decision, they also have decisions to make in making a progress in the climate and earth initiative. They also have their own role to play. In as much as the healthcare is there for them, they also have a role in decision making. For instance, let's come to the aspect of malaria, for instance. We all know that we have bushes around, dirty places. Definitely is a breeding spot for malaria for mosquitoes. So we let them know you have a role to play in taking care of your surroundings, no mosquitoes. So they also climate and health initiative.
Thank you very much. We all have a role to play. So this is not a time to believe or not to believe whether you're influencing, your activities are influencing climate change. That's a nice one. Well, I'll hand it over to Kehinde. Kehinde, please continue.
All right. Thank you. Thanks so much, Juliet. Okay, if you are just joining or you are just wondering what's the topic that we are talking about, this panel is on community and planet health, and we have in our midst Okuna Juliet from Delta State. All right, so I just want to ask you, how did you see partnership? In SDGs, we have the SDG 17, talk more about partnership for the goals, and everything we do now, partnership is key and collaboration. As with your work in your community, so how do you see the partnership and collaboration with maybe local organizations or maybe CBOs, community-based organization around you, or maybe the stakeholders around you, maybe the community stakeholders? How are they supporting the primary healthcare in your area, and also related with the climate change as related with children?
Thank you very much. This question is just like you're just talking to me directly because I'm partnering with the healthcare. I don't work with the healthcare directly. All right. I was when I graduated and did my youth service, I was posted to the community primary health care at Udeji here in that state. And I did my youth service there. I continued volunteering there until after my youth service. I continued there without pay, of course. And until Simadi found me, and I actually work for Simadi and not for the primary health care. So this question is more or less like me because I'm partnering with the primary health care. Now we have partnership and collaboration with two non-governmental organizations. One, of course, my organization, Simadi, Coastal and Marine Area Development Initiative, and Rotary Club of Udeji. Simadi is a non-governmental organization that works with communities, local communities to organize health, education, and environmental projects to improve the well-being of the people. So some of these programs that have been organized by Simadi are wash sanitization. Wash, which means water, hygiene, sanitation and hygiene, and also organize the free health checks, free medical checkups, free vaccine, free medical advices, free health education every last Saturday of the month. Simadi does all of this. Then also, Simadi helps to bring all the young ones, women, children together, and also educate them about the need of keeping the environment clean, the need of using natural products, natural resource, natural, how do I place it now? In making things like bags, for instance, that can easily be absorbed back into the atmosphere, like our polythene bags. These are all of these and more are what Simadi does. Then the Rotary Club of Udeji, not Nigeria, sorry, the Rotary Club of Udeji also is also a non-governmental organization that is involved in child and maternal care. Recently, they were at Udeji healthcare. They gave out so many items, soaps, detergents, so many items that were given to these mothers, because the situation we are in the country is quite funny. These women are being affected. They are being affected. So they try as much as possible to see how they can help, how they can come into the community. And of course, the community also helps in the sense that they keep our health facilities safe for us to work in. They keep it safe. They help distribute the awareness that there is an health facility here on Udeji. So if you need it, please come here. And by the time we have issues or we also go to the this is it, and they come in and they assist us.
Okay, all right. Well done with your work, and I really like that you collaborate with others. I like your story that even being started as a core member serving in that healthcare center, and even you are now there, even part of the community, serving them and also improving their health outcomes. I think that's also good. So let me just bring in this question. When we talk about needs of women and the children, the needs, needs everything, needs of everyone is unsatiable. We all want different things. And that's why you are still going to all these communities, because health challenges can come at any time. So how do you balance these immediate health needs of women and children with the long-term goals of building their climate resilience? So how do you balance it in the community health setting?
Education can never be overemphasized. So number one is education. We prepare this mother, we prepare the mother and child through this educative means. We let them know there is something like this, there is something like this, there's something like this, and this is how to tackle it, this is how to tackle it. So educative means is one, and it tops the table. Then also, through this educative means, we'll let them know that when they improve their health and nutrition, this is going to happen, this is going to happen, and this is going to happen. We also teach safety rules in case there is a disaster risk. There's a disaster, they will also teach safety rules in our facility. So we protect both mother and child through the WASH initiative. Of course, I did mention of that. One of our major challenge right here is WASH, water sanitization and hygiene is one of our challenge here. And it's one thing, I think that's the SDG 6. And that's one thing Simadi is known for at Ubeji right here. So we try as much as possible to push this WASH into the community. We'll let them know this water you have is not for fancy. You should use it. So we let mother and child know this is it, this is it, this is it. And we all know children learn from their mothers, especially they are their first teachers. Let's not bring fathers into this. So let's just say they learn directly from mothers. That's the first teacher they know. So if your child wakes up and see that you wash, you clean your environment, you are hygiene conscious, you see that child grow up to be WASH conscious.
I think we should work more on how our fathers and male can also be a champion in all these things. I know, and I'm just kidding. It's good. If this message gets through the women, they pass it around and also influence people around them so easily. Thanks so much. So I'll be passing the mic to Adaobi now. Thank you so much. You can unmute your mic.
Thank you so much, Kehinde. Like you rightly mentioned, our fathers need to be involved in all of this. It's not always the mothers. These women will not kill themselves for us. So that's a very nice one. Okuna, while you were talking, I heard you make mention of teaching disaster risk reduction through health education. That was a very nice one. Exactly. Safety first in everything that we do. So there is need for mitigation, because in climate change, we are talking about mitigation, adaptation, and building of resilience. So that's a nice strategy, teaching them about how to reduce the risk that they get involved in during a disaster, because definitely in this era of climate change, especially in the riverine area, we find out that there is always one form of flooding, one disaster or another. So having talked about that, Okuna, I would like to ask you, as someone that is involved in female and child health care, what are the policy changes or advocacy efforts that you believe that at this level where we are, we've made a lot, that the government, the international organizations, that need to do, they need to make some policy changes, they need to put in more effort in what areas to ensure that they support the activities that are being done at the primary health care level in the context of climate change?
The climate crisis is here and it's accelerating. It's not going anywhere anytime soon. So, and global emission reduction remains the only long-term solution to the climate crisis. I would use our Warri as an example, not just Warri, for instance. Over 2 weeks now, I think, 2 weeks or thereabout would have like, we'll be running Jane and releasing CO2 into the atmosphere. Let's not talk about the the tankers that moves to and flow our environment, since we are at the depot region, the emission, the release of that CO2 on a regular basis. Now, this is all to the government. I don't want anybody to come and chase me away from Mario. Let us breathe with light. Give us light and reduce CO2. Let us have light. If we have light, if you can hear clearly, you see, you hear generator coming from my left, right, middle. All of these are we are mixing it up with CO2, which is giving us steady light. They should, even if they don't want to give us light, they should dash us solar. So the constant in all I've said is we should try we can keep down release CO2 into the atmosphere. Portion of the problem, a small portion of the problem will be solved, and the atmosphere will be clean enough for us to breathe in our clean and purified oxygen. Then for our international body, our vaccine is made from the international body. Abby, you should please try as much as possible to give us your chance. Yeah, I'm laughing towards it. I'm laughing at it, but it's actually a trouble. It's a point of concern in the sense that for some time now we have shortage of vaccine for our children. Okay. And we all know Nigerian doesn't, I don't think Nigerian produces this vaccine. So we have shortage of it in the states at large, in the state at large. And you see these women, they don't really have enough to eat. Not to talk of going to a private hospital to get these vaccines for 25,000, 30,000, and so on and so forth. So where they can get it free, they should please make it available for Nigerian government. Nigerian government should make it available primary health center.
That's a nice one. So Okuna has made mention of policy changes in the area of electricity. It's either the government works on providing steady electricity so that the emission level will come down a little. People who don't have to on their generator every now and then, or subsidize or find a way to make solar energy, which is of course a clean kind of energy available to the average member of the population, because for now it seems like it's meant for those that are rich, because these are the people that can afford it. So, and she also made mention of prompt delivery of vaccines. That's from international organizations. They are trying a lot in this regard, but more can still be done. More efforts can be put into ensuring that these vaccines are always available for children at this level. So generally, during our conversation, Okuna has made mention of different problems that women are facing. She has made mention of ignorance, where people attribute everything to prayers. Even the ones they can do for themselves, they will feel is spiritual. And the role of health education in addressing this level of ignorance amongst women and children. But we want to also find out that in your experience working with these people at the grassroots level, we want to find out some of the most pressing health challenges. We know we have a lot of them, but those ones that you feel that those pressing health challenges for both women and children that you feel are directly linked to climate change, and how are you, at the workers at that level, prioritizing addressing them? That is, let's say this is linked, let's say diarrhea is linked to climate change. These are the efforts we are making to ensure that there wouldn't be an outbreak, or we'll manage it to a reasonable extent, even if we don't eventually eliminate it and all of that. So we just want to find out the pressing health challenges and efforts being made to address them. Thank you.
All right, thank you. You've made mention of one already. So I think what's topping the table right now is malaria.
Okay.
Malaria is what tops the table. And like I said, when there is flood, give room for mosquitoes to breed. And this is a challenge because every day you must see one or two mother or child being rushed to the facility. When you do further investigations, you see it's malaria, probably 2+, 3+, and treatment will commence. Now, it's not just the treatment, because when you treat in the next month, that child will return, or the mother will return. You treat the next month, they will return. So now, what do we do to them from treating times before we address their environment? How clean is the environment? How clean is the environment? After the flood, it's a good thing that this flood doesn't last long in our own vicinity. So what efforts do you make to make sure your environment is clean and safe, that mosquitoes cannot breed in? So we address that, and we'll give further advices, we give further education to them. This is how it should be, this is how it should be. And thank God for our government that brought in mosquito net, treated mosquito net. So we give out treated mosquito net to see how we can prevent the reoccurrence of malaria. Then another one is typhoid. That's another thing fighting us in this part of worry. After the flood, there's contamination of our drinking water, contamination of even our legs are contaminated because we would step into the water. Our hands, and our kids, most of them, like my own child that but every little thing she sees on the floor, she lost stream. Now, by the time they come to the facility, and after investigation, you find out that it's an infection in the blood, treatment commences. But you see, after you finish treating, it will reoccur and reoccur and reoccur. Then you will ask, Madam, which water will they drink? That's the number one question. Madam, which water will they drink? Then you will find out that the woman that you are asking the water she's drinking is our septic tank is not even far away from our borehole. It's a challenge that has to be tackled. Now, how do you tell that woman not to drink that water? It's also a problem because she does not have money to buy pure water or bottled water. It's also a challenge. And that's where Simadi comes in. And Simadi has this biosand filter. It's affordable. So we'll let them know this biosand filter, it's affordable. It purifies your water. All you need to do is from that same tank you have, pour it into the biosand filter. After some time, it will purify your water and it's safe for you to drink. That is another will I call it a solution being provided by Simadi to our communities. Then cold is another, which is a flu. Of course, this one is something we cannot control, but we can we cannot control it, but we can regulate it for us, in the sense that I've made mention of this, clothe your children according to the temperature. When it's cold, cover your children perfectly. Cover yourself perfectly to avoid the cold, to avoid the flu. Then of course we have diarrhea, which you have made mention earlier. So the facility gives the treatment. The facility gives the treatment and the education, of course, followed by the advice. What we can do, we do. And we allow the masses, or we allow the people go home with the advice and try as much as possible to heed to it.
Oh, that's nice. So our viewers out there, she has mentioned malaria, typhoid, flu, diarrhea, and all forms of preventive measures. So thank you very much for that response. I'll hand over to Kehinde to continue.
All right. Thanks so much. Thanks so much. When you mentioned these sound pit tank, I think because
Biosound
I said
feedback.
yeah, I served in Baeza and Yenwa, and I think we use that kind of sound that tank too. That we have the sand, then the water will be filtered and come out because of the nature of the sound. The soil in Yenwa, because the water that come out, they are not that totally clean. I think that's one of the solutions. And that takes me to the questions that are going to be my own last question for you here. We talk about community-led initiatives. Initiative is just like solutions that people bring in to see how they can solve some problem that are peculiar to that community. So the question would be, can you share an example of maybe a community-led initiative that has been effectively empower women and children to become active against mitigating climate change around us? Thank you.
Okay. It's a good thing we have Simadi in our environment. So Simadi has educated women and children about conserving our natural resources. We also have a natural conservation park, a mangrove park here at Ifie, Ijala. Here, we make use of. We've also taught this. We've also teach these women how to make use of natural materials that are biodegradable, rather than using those ones that are not biodegradable, like synthetic bags, for instance. What I mean by synthetic bags are polythene bags. We can actually use, you see these raffle. I think that's what they call it. This stuff. I think I've forgotten the name of that plant we use in making nets and bag. We can make use of that, and it's reusable. You can wash it and use it again instead of using these polythene bags that you can just throw into the atmosphere, into the bush, for instance, and it's not going to decay. Instead, it will cause problem in our society and start causing issues here and there. Also, Simadi has also educated the masses at the community level about dumping of waste into the river. You see, go to our rivers, you see dump of waste, bottles, papers, and the rest into our rivers. Simadi has educated it, and it has been reduced also. You see, this our people no longer dump their refuge into the river. It has been reduced. Also, Simadi is one organization that takes hygiene. They take hygiene so seriously. There are times we do community cleanup. We just look for volunteers that help clean our communities. All these are what this organization, Simadi, has done to help women and children to conserve our natural resources, which at the end will help the planet. We have a park here. When you come here, you wow, because you breathe in fresh, cool, clean oxygen. You ask yourself, are we still in Nigeria? Yes, we're in Nigeria. So it's a place where we reserve our natural resources, our natural plants to conserve our energy and so.
Yeah, I think that sounds good. And the part of the park, I can see how you are just telling us about the coolness and the greenness of that place. I think that's good. And the cleaning of the environment, or coming together of the community, cleaning the environment, and to clear the places from dirt and plastic. I think those are also good. I think they are also good community-led initiative being done by a community. Thank you so much. So I'll go straight to Adaobi to take it from here.
Okay. Thank you so much for. Now, finally, we'll have our final question, just like we're having a wrap of what we've been doing so far. So, we want to know what advice you have for people out there, what you have to tell them about climate change. For those that believe, for those that don't believe, it's a reality, we've come to face it, whether they like it or not. So generally, in trying to wrap up what we've been saying, what advice do you have for people as regards their health and climate change? What efforts should they put in towards ensuring that the effect of climate change doesn't hit so hard on them?
The advice I would give to people is change your behavior, change your mindset. Your behavior will lead to your mindset, or rather your mindset will lead to your behavior. When you change it, you'll change your environment, and will have equal benefits when you change your environment, in the sense that the plants will benefit and you also will benefit. And for instance, the intake of fruits, green leaf, and vegetables that are healthy for you as an individual, and also for the plants. So if you take care of yourself and take care of your surroundings, take care of your environment, I think we'll have a better ecosystem that would be comfortable for you and also the plants. And let's not forget about the animals, because they're also affected of the other. They're also affected. So if we take care of our environment, especially, we'll be able to at least reduce the effects of climate change.
That's nice. And finally, what would you feel like in the nearest future, the role of primary health care? What's the intersection for you? How you feel, what they can do in this fight against, in this prevention of climate change? When we're trying to prevent it, what role do you feel that they're playing now, they've played before, and they will still play in the future to ensure that we adapt better to this incident of climate change?
I would say primary health care have the potential to enhance primary health care and are particularly effective. They are very effective when they share common interests with the community. For instance, if you understand their culture, their language, and you also have experience with the community, it will be easy for you to relate with them as a caregiver. The primary health care can influence policies, can influence policies makers for favorable provisions to reduce environmental impact of healthcare, and thereby provide healthful benefits. I would say the healthcare givers can also give advice. I've said it before. We can also give advice to people for behavioral change that can affect our environment. So technically, all we can do is to give advice, speak to policymakers, be friends with the community, and try as much as possible to give a little back to the society as Earth caregivers.
Thank you so much, Okuna Juliet. It has been an interactive session with you. We're so excited to have you this year at the Planetary and Climate Change Committee panel of the Engage Africa Foundation. We are delighted. You've really shared so much with us that I believe our viewers out there, they have learned a lot from this session today. It's been an insightful session with Juliet and Kenny. Kehinde, do you have your last words for our viewers before we wrap?
Yeah, I think, like you said, it's an educative session. Even me on the panel, also I've gained. I keep hearing women do more than men, so I think I can take that. I can take that. I can take that. So thank you, Juliet. Thanks for the wonderful work you are doing in your community. You are really changing the narrative of health, community health in your community, and I can see the passion that you have. You like what you are doing. I think that's one thing that is driving you to keep going and keep doing it, even in that community. I say keep doing and keep going. I think the world needs people like you to change to change and improve the health outcome of people in the community. Thank you so much.
Oh, that's a nice one. Thank you so much, Juliet, for coming on board. Thank you, Kehinde.
Thank you, Adaobi.
All right, bye from here.
All right, bye.